Good evening, everyone. A warm welcome to this neurotherapy session. And you all know all these are free sessions dedicated to all Joshi Kerala group members. So I request each one of you to please gather around and send these links to all your family, friends, because this is a very important session on kidney stones. Please understand now with lifestyle, many of us are suffering from kidney problems and none of us are left behind. At least if not now, in future we'll be having many other issues with our kidneys. So to understand this issue very much in physiology, anatomy and every way, we have our respected Acharya Ji Ramachandran sir today. And today is 20th June 2025. And at 8 p.m. we are starting this session, and this is a free session for all of you. So please invite all your family, friends for this session so that they can understand how we can help the kidneys in relieving from stones and other issues. Also you'll be able to understand, and the treatment process also you'll be able to understand, which will help you to release much of the issues. See, if you are in CKD problem or going through dialysis, that will be a severe chronic stage. You can't ask us, can we come out of this within 1 or 2 days of treatment? No, I would say no. This is not possible. But when you continue, at least you can see a ray of hope in this particular thing, because it will be removing all the other problems associated with CKD or dialysis that is troubling you personally. Okay. So don't ask us for chronic things that within 1 or 2 days will it be over. It won't be over. No one can say, even a doctor can't say, if you're going through dialysis, you will be back to normal, because that is not possible through allopathy. But when you take it alternative therapies, this is not like that. You have to have trust, and you have to be very, religiously following the treatment and very faithfully, because unless you have faith, unless you have, religiousness, you won't be able to concentrate on the treatment, and you won't be able to do it religiously and dedicatedly. And remember, when you're doing treatments, you are doing all this only for yourself or your family or friends, right? So you need to be very careful when you're doing it. Don't be rash in the treatments. Please follow the pressure or whatever sir is telling. If you don't know how much to follow, how much to pressure, you have always the group to ask. And you have always these sessions. At the end of the session, you have the time to ask your queries. So I request you, please make notes. Wherever you have doubts, when you make notes, you underline it. Okay. So that underline of your notes will remind you what are your doubts. You need not write it again, right? So I'm just making your task easy by giving you ideas and tips and asking you to share this links with all your friends and family, so that you're not only helping yourself but all the people around you. Even you can share it with your neighbors who is interested to understand this theory. Spending lots and crores, lakhs of rupees in allopathy and medicines is only going to trouble your health. It is very much necessary, we all agree, because in emergencies only it helps. But there are many side effects of these medicines which we need to avoid. So I request you all to please concentrate on every session Joshi Kerala group is providing you, because this is for your own well-being and for others also. You're not only helping yourself, but others with all these sessions. So with a warm welcome, I invite you all to this session, and others with all your, grace, dedication and gratitude. I forward this grace, gratitude and dedication to Ramachandran sir today for this wonderful session on kidney stones. A warm welcome to you, sir. Good evening to you. Please take over the session. Thank you so much.
So, good evening. At the outset, a very warm welcome to all of you who have joined here for this session on kidney stones and its relation to high BP and diabetes. And today we will be having a little bit more theory, because unless and until you understand the theory and you are convinced about what I am saying makes sense, only then you will be inclined to follow what I say. So with that preamble, I thank Joshi sir, Joshi's Kerala group members, and Anusha madam. And incidentally, this the seed for this topic was given to me by Anusha madam, because she was telling that so many people are suffering from kidney problems. Can you take a class on this? So then the most common kidney problem is kidney stones. So I said, okay, we can have a lovely class on this. And I have prepared accordingly. And if any time anybody has any query, you can raise your hand, preferably at the end, unless it is absolutely essential to raise it during the class. That will be better that you can raise it at the end. We will have quite some time. I'll be giving theory for about approximately 45 to 50 minutes or maximum 1 hour. Then at least another 45 minutes we can have for question answer sessions. Okay, so that's the way it should be going. And the matter I have gathered is quite huge. So either we'll complete it this week or we'll take it over to next week. Okay, but your questions will be answered. Okay, fine. So now all of you can see our dear Guruji, we call him Param Pujya Guruji, Dr. Lajpat Rai Mehraji. So our salutations to the man of the millennium, the epitome of Dhanvantri, the father of neurotherapy, the most revered Guruji, Dr. Lajpat Rai Mehraji. So our obeisance to him, and may he shower his blessings on us and help us to understand the nuances of this wonderful medicineless therapy called Lajpat Rai Mehra's neurotherapy. Okay, so now today's topic is, as you can see, kidney stones, a deeper insight into causes, complications, and connections with hypertension and diabetes. So, of course, I have written some things and you can read it. Those of you can zoom in and you can listen to me also. But more than that, please listen to whatever I say, because not everything has been written down. Okay, so not everything is written down. So of course, today we are going to explore a condition that's very common, often painful, and yet misunderstood, because sometimes people get afraid of the word kidney stones. So we'll explore how this condition is not isolated. It is deeply connected to systemic issues like high blood pressure, diabetes, and this makes it a perfect example of how our organ systems are interconnected. That means no organ system is working independently. It is connected with all other organ systems. The kidneys don't work independently, and no disease is only because of one particular organ. Understand this, because sometimes people ask me, and in other places, they say, please give me a formula for something. So the body does not work on a single formula. It is not like a pill for every ill. Okay, so you have to understand that we have to understand the whole system. If we want to eradicate something from the root cause, there is no point in just going at the grassroots level, I mean, at just the top level, working at the level of the leaves, when actually you should go to the roots. So that's why we will go today beyond just stones, and we'll talk about how Lajpat Rai Mehra's neurotherapy, that is briefly abbreviated as LMNT, it offers a natural and powerful way to manage and reverse this condition. So let us understand first. We should understand what a kidney stone is. So what is kidney stone? In Hindi, it is called Gurde ki Patri. Okay. So kidney stones They are nothing but solid masses made of crystals. And these crystals are made from the body fluids. Understand this. It's just like, you have a glass of water and you go on adding, let us say, sugar. You add 1 spoon, 2 spoons, 3 spoons, and you go on stirring it, stirring. Okay. After about, say, 5 or 6 spoons, you will see no amount of what you stir. Some may remain. But suppose you say you have put 4 spoons or 5 spoons, whatever. Okay. And then you see it has dissolved. And after that, suppose you keep it for 24 hours, you will see that slight small masses of crystals of sugar will be formed along the rim, isn't it? How did these stones come? They get, so it comes from the air? No, they have been generated from the liquid which was within that glass. So like that, when the kidneys, whatever fluid is there in the kidneys, they are all part of our urine and other fluids. Whenever any particular component is in excess, then it will deposit itself as a stone. So a stone, to dissolve a stone, you require the same liquid. Just as to dissolve the sugar, you don't require any other extra liquid other than the water in which the sugar syrup was made. You require a little bit more water, then that crystal of sugar will dissolve. Similarly, when you have to talk about kidney stones, we should understand that to dissolve the stone, it will be the same liquid only. So this is at the background. It's not so easy, but it's at the background you should understand. So the formation of a stone and its dissolution are both very simple logic. Okay. So these stones, where do they originate? They originate in your kidneys, but they can travel down the urinary tract. Anywhere from the kidneys to the bladder, anywhere you can have a stone. And depending upon the location of the stone, you may have different symptoms. Okay. So quite often we hear people will say that my urine has stopped. I am having very great pain in my waist, in my hip, and in the night suddenly I got up, and then I was down with severe pain in the hip. These are the classical signs of kidney stones. So you can now understand, if your urine is stopping now and then, it's not coming in good flow, and at the same time there is a strong pain in the waist, in the back, lower back, etc. And then sometimes at night you are sleeping, you are perfectly fine, but suddenly you wake up with a severe pain in the hip, then it is possible that it could be due to kidney stones. We'll see later on also how these are to be diagnosed. Okay. So kidney stones are medically termed as nephrolithiasis. Anything to do with the kidney, it will have the word nephro. A kidney specialist is called nephrologist. So the word nephro, so that means anything to do with the kidney. Okay. So, and in common parlance, it will be called as renal calculi. Renal also means to do with the kidney. Okay. So either it will be called nephrolithiasis or renal calculi. Okay. Then what are the major types of kidney stones? There are 4 major types. One is called, the most common, it is called calcium oxalate. Then you have got uric acid stones. Then if you have an infection in the body, you will have what is known as struvite stones. And finally, if you have some genetic problem, you will have what is known as cystine stones. So these stones can range in size either from a grain of sand, very small, a mustard seed or a grain of sand, or they can be bigger, as big as a chana, or even bigger, like the size of a golf ball. A golf ball is pretty big, like let us say like a cricket ball. Okay. a golf ball. So it can be of any size, and from the bigger, the golf ball did not happen all of a sudden. It started from a sand, size of a stand, or then it developed to a size of a chana, which you did not understand earlier, in the sense you did not diagnose it earlier. So you just ignored it. Then from the size of a chana, it became bigger and bigger, and it can be up to the size of a golf ball. So then the question will come, why do kidney stones form? So let us understand the causes in our Indian context. The first thing, pani kampina, drinking less water. That means not staying hydrated. So the number one reason is dehydration. I told you that the kidney stone is made of the liquid in the kidney, which when gets concentrated, then it forms stones. So that liquid in the kidney is a main ingredient. What? Water in the blood. Okay. So when the blood water becomes less, that is called dehydration. Okay. So dehydration is the number one reason. And dehydration, of course, can be following loose motions or vomiting, etc. But this is not the dehydration which I am talking about. The dehydration I mean is, it is dehydration due to not drinking adequate water, either because you feel drinking too much water will make me go to urine often, so you stop drinking water, or you are very much engrossed in your work and you cannot drink water because you have to again go to the bathroom every time, so you don't want to drink water. So these may be some of the reasons. Of course, some people, like some children, may have a genuine problem that if they drink water, they feel the pain in the abdomen. So that is possible for some people, some children especially. But otherwise, for adults, it is only because they do not know that they have to drink water, otherwise they can get kidney stones. So ignorance. So and tell you, please remember, all of you, please make sure that if you want to keep away from all these problems regarding to the kidneys, the first thing you should do is to keep yourself hydrated. Dehydration is the number one reason. Then the next one, eating high salt and spicy food. In Hindi, we call it zyada namak or masaledar khana. High salt and spicy food. We Indians are very fond of spicy food. No. So it is okay when it is taken in moderate, moderate quantity. But eating lot of achar, papad, these all contain salt, chips, all these contain extra salt. And then also having the same type of high salt in our food and eating masaledar khana, that is where the problem comes. It is not that you should never eat masaledar khana. We don't say that, because in Indian context, it is very much an essential. And all our ancestors have taken masaledar khana and they have kept very healthy. So the point is, now it is becoming in excess because we are having so many packed foods. We call it dabba packed items. So many packed foods, in all that masala is, salt is too much. Okay. Then high intake of spinach, tea, chocolates. These are all oxalate-rich foods. Spinach, tea especially. Tea is nowadays a very common thing. Drinking in the tea in the office, or at home also, drinking 4 to 5 glasses spread out over 3 hours. Morning 7 o'clock 1 glass, then 11 o'clock 1 cup, then another maybe 3 o'clock with this thing after post lunch. Okay. Then after that, again at 6:30 or 7, we come home from office, we have another tea, like that. And maybe some client comes, then you offer him a tea, you also drink tea. So like this, tea drinking is also one of this thing for oxalate stones. Then eating a very high protein rich diet, chicken, paneer, or animal protein in excess. The amount of protein you can take depends on the amount of physical labor you can do. So if you are doing a lot of physical labor, heavy manual work, then definitely you will be able to digest whatever protein you take, you eat chicken, mutton, whatever you like, you can digest it. But if you are leading a sedentary life, in that case, you will not be able to digest that protein. Then that in excess forms uric acid stones. Okay. Then low calcium in diet. Now you will imagine low calcium in diet should not cause any stone. Paradoxically, too little calcium can increase oxalate absorption and cause calcium oxalate stones. That means eating a low calcium diet, that means unknowingly not eating enough calcium. And for calcium, one of the most important thing is you have to be in the sun also, because vitamin D, it is essential. Sun bath, staying in the sun is very essential. So that will all come under low calcium diet. Low calcium diet or low sun diet, let us say, they will all can cause increase oxalate absorption. And last but not the least, sedentary lifestyle. So these are all the causes, some of the important causes for kidney stone formation. Okay, in North India, we see a spike in cases in summer, which in kidney stone cases. Okay, we see a spike because due to extreme heat and inadequate hydration. So the only time in the extreme heat, what we do, we drink aerated drinks, and that also causes problem. Instead of aerated drinks, we will do better to drink nariyal pani, coconut water. In South India, where coconut water and buttermilk are consumed regularly, you might have known that South Indians have to finish their dinner, their lunch or dinner with coconut, with this coconut rice. I'm sorry, buttermilk rice. Okay, so buttermilk rice is a distinct necessity for the heat of that region, and so it has been put in the custom, and that is why we don't have in South India so much problem as you have in North India, because North India, the drinking buttermilk, of course, it is there in certain communities, but still not the way we South Indians take it, perhaps. So that is why in North India you see a spike in kidney stone cases. So now let us see how this links with systemic disorders. Okay, so the common symptoms, the symptoms may vary based on the size and location of the stone, but they normally include symptoms of kidney stones. I have already told you one or two symptoms. Now let us see a few more. Severe cramping pain in the back and side, approximately in the region of T12 or T10, T12, okay, on both sides, or slightly lower, L1, L2, that those vertebra, in that region, there can be a pain. Okay, and this when it is due to a stone, it is severe cramping pain, just comes and hits you like anything. You may even, the whole body may sometimes, because of the pain, you may even perspire too much. Then the pain radiating to the lower abdomen and groin from the front side, it can be pain radiating to the lower abdomen and then going towards the groin. Then some people may have blood in urine, that is when the stone is in the bladder. Okay, severe cramping pain in the back and side may be when the stone is higher up, but blood in urine can be because of the stone being in the bladder. Okay, because that is how you will get blood in urine. And then nausea and vomiting is possible, maybe not always, but yes. And then frequent urination or burning during urination. Okay, these are all some of the symptoms of stones. So many people with early stage stones may not feel anything at all. That is another misery. Okay, so you may not, so you will never know that you have a stone till it is diagnosed by mistake or by just by this thing, coincidence. So now let us come to the most important topic of today, the kidney stones, high BP and diabetes. What is the connection? So First of all thing is, the real shocker is stones don't happen randomly. That means they don't happen in the absence of any disease. Quite often, there will be one or two of the following. So they are tightly linked with either high blood pressure or diabetes or obesity. And if a person is having all these three problems, which nowadays many people are having, they are very obese because they are having the desk job. So they don't do much work, physical exercise. So they become obese, and many of them, due to lifestyle problems, they may be having diabetes and high blood pressure, all three together. So for such people, kidney stones are quite likely. So if any of you is here, please pay very good attention to this class. Okay. Multiple studies have shown a strong link between kidney stones and high blood pressure. So then naturally question will be, why kidney stones are linked to high blood pressure? So I am going to give you some physiological points. Number one, the kidney damage due to stones. See, the stone, when it goes and goes in the kidney, it's a very small stone. It is not a very big stone in the kidney. It more develops down. So when it is there, it goes and pricks on that skin, and that skin, the flesh over there is very soft. So then the kidney gets damaged due to those stones. And it causes, whenever kidney gets damaged, there is hormonal dysregulation, because the kidneys have to manufacture a couple of hormones also. One of the most important one is the 125 DCC, that is for calcium, a hormone made for calcium absorption. Like that. Then there is another this thing called enzyme called renin. So all these are manufactured by the kidneys. Erythropoietin is a hormone for RBC production. So these are all manufactured by the kidneys. Okay. So then when there is kidney damage, then this will cause hormonal dysregulation. And that system is called renin angiotensin aldosterone system, RAAS. So we don't have to go into the technicalities of it, but understand that kidney damage due to stones leads to elevated blood pressure. This has been found. Physiologically, it is a known truth. Then chronic kidney inflammation. Whenever there is a friction, that place will get first, some injury will be there inside, then it will start getting inflamed. So chronic kidney inflammation from recurrent stones that may stiffen the arteries within the kidneys. First, it will stiffen the arteries within the kidneys. Then later on, because of high blood pressure, arteries outside also can also get stiffened. Then what are the shared risk factors? High salt intake, obesity, and poor hydration, which I have spoken about. So a Harvard study found that people with kidney stones were more likely to develop hypertension in the future, especially if they had recurrent stones. So they have made this study. So let us come to a simple Indian example. We had a case of Mr. Desai from Gujarat. He was 58 years old, and he had been diabetic for 12 years and high blood pressure for 8 years. So he came to us with severe back pain, and then on investigation, it was found to have a 1 centimeter stone. Now, a 1 centimeter stone, though we may think it is not very big, but it is enough to cause severe pain. Okay. And his urine was highly acidic, pH 5.0. Okay. And uric acid was 9.2, which is also quite high. And then kidney function was in the borderline. EGFR was 58. Okay. So here, high blood sugar, he was diabetic for 12 years. High blood sugar leads to more acid in urine. So, and that causes uric acid stones. High BP damages the kidney filtering units and causing calcium leakage, and that also causes calcium stones. So this is a vicious circle. Okay. So what is a vicious circle? The stones damage the kidneys, the BP worsens, then BP damages the kidneys, the stones are formed. And diabetes dries the body, and so crystals precipitate. As I told you, whenever the liquid content is less, then the stones will precipitate, and that is what leads to stones. So these are not separate diseases. You will think kidney stone is a separate disease, BP is a separate disease, then high blood, this thing, diabetes is a separate disease. No, they are all one connected pathology. So now let us see kidney stone and diabetes. So diabetes increases the risk of kidney stones due to the following factors. Number one, in diabetes, you know something called insulin resistance. That means the body is preparing insulin, but the cells, they don't respond. That means even though there is insulin in the system, in the blood, the glucose is not able to enter the cells in spite of insulin being there. That is called insulin resistance. Okay. Then this, whenever you have insulin resistance in diabetes, it will alter the calcium and phosphate metabolism. And calcium and phosphate metabolism, they are very much interlinked, and they are all necessary for the health of bones. Then because calcium metabolism is altered, it leads to calcium stones, and that is by increased calcium and oxalate excretion in the urine, and there due to the lack of water, the calcium oxalate stones form. Then we saw here the case was he had this thing, urine was acidic, pH 5.0. Okay, so when that is called decreased urine pH, and this is particularly in type 2 diabetes. So that encourages uric acid stone formation. Then there is dehydration due to frequent urination in diabetes. Okay, so all these things are due to diabetes. Okay, and interestingly, people who form stones are also more likely to later develop metabolic syndrome. So that means a person, metabolic syndrome, diabetes is called a metabolic syndrome. Okay, that means improper carbohydrate metabolism. Okay, so that many diseases are called as metabolic syndromes, and they are all from people who originally they did not have the disease, but they had the tendency for forming kidney stones, and then later on they developed into metabolic syndrome. So this is a vicious triad. These three. We often say in medicine, where there is one lifestyle disease, others follow. So how do we understand what is this triad? High blood pressure affects the kidney and stones form. Then diabetes damages kidney filtration, again stones form. Stones further damage kidneys, then because the kidneys are damaged, the blood pressure becomes more and more higher, and then that the reduced insulin control happens, and that is how you are getting a cycle of kidney damage, inflammation, and increased systemic risk. This is why kidney stones must never be seen in isolation. Don't think that kidney stone is just one small problem. A little bit of a painkiller will help it. No, please don't do that way. Okay. So what can we do in neurotherapy? We will see later. Okay. Now let us have a real example. Mr. Ramesh, 52-year-old, diabetic and hypertensive. He came with flank pain, and he was found to have a 9mm stone lodged in the ureter. 9mm is less than 1 centimeter. Okay, 10mm is 1 centimeter. So this is a smaller stone than 1 centimeter. But still he came with flank pain. It leads to severe flank pain. On further testing, we found reduced kidney function. eGFR was 58. It should be around 90 preferably. Then we found microalbuminuria, so albumin in urine. Then early signs of kidney damage. Now, had we only treated the stone surgically, we would have missed the systemic issue. That means systems were all getting affected. Instead, we treated the stone through LMNT, methods. Then optimize this blood sugar. We have got wonderful these things. All of you know, I am going to have a diabetes challenge class, second challenge class next month. Okay, so we have got wonderful results in blood sugar reduction through neurotherapy. So that we optimize this blood sugar and blood pressure, and we started him on lifestyle modifications. Yes, that is another very important thing. Lifestyle modifications are very much necessary. So by all this, his EGFR is 72. From 58, it went up to 72, and there are no new stones after 1 year. And another thing is he was not regular in taking treatment. If he had taken treatment regularly, those old stones would have they completely dissolved quickly. But this thing is, but his blood sugar also improved, blood pressure also improved, and stone also not there. And another, the most importantly, no new stones. That's this thing. People who treat stones surgically or by medicines, sometimes the stones come back another in a later time. So we don't have that sort of thing. So now you will be impressed to find out what should be the diagnostic tests. What are the diagnostic tests we must know? So this also we should be able to understand. So if you suspect stones or already have BP or diabetes, then these tests are must do. We'll just first run this thing, then we'll see each one of them. Okay. Then we have got blood tests, serum creatinine, urea, then EGFR for kidney function, then you have uric acid, then you have fasting blood sugar, HbA1c, then you have urine tests, urine routine and microscopy, it is called URM. Then you have 24-hour urine calcium and oxalate, then urine pH. These are all some of the things. Any of you can even take a screenshot. I will just increase this so that you can take a screenshot to know what are the important tests we should do. Okay, so these are the important blood tests and urine tests which are very much essential. Then you have imaging. Imaging, of course, is anybody knows, but the other tests are more important. Okay, and then then if necessary, in very small rare cases, you may require a CT KUB. Okay, KUB is kidney urinary bladder. Okay, or kidney ureters and bladder, whichever way you say. Okay, then without these tests, we are treating blindly. So in this thing, in LMNT, we are not treating kidney stones as isolated mechanical problems. So now we'll see why stones form from the elementary viewpoint. So we look for causes such as improper water absorption. The person, sometimes people come to and say, sir, I drink nearly 3 liters of water, sir, and still I am having kidney stone. So that means that is because the water absorption is improper. Then more importantly, liver stagnation and poor bile flow. Then there is hormonal miscommunication via the medulla and the pituitary. Okay. Then digestive imbalance, and this is this digestive imbalance which causes high oxalates or uric acid. So what are the treatments? We will focus. Number 1, improving circulation to the kidneys. Number 2, enhancing liver function. Number 3, regulating pancreatic and adrenal output. And number 4, rebalancing water and salt handling. So improving circulation to the kidneys, we have certain formulas called kidney clearance formula. Then enhancing liver function, we have a treatment called 1-point liver. Then we regulate pancreas and adrenal output, we have treatments for them. And then by doing all this, when you improve circulation to the kidneys, automatically water balance is obtained and salt handling is also much better. So this is a beautiful example of systemic correction. So according to LMNT, stones form when either See, there are 4 cases, what we say. Number 1, kidneys are underperfused. Underperfused means they are not getting proper blood and nerve supply. And in neurotherapy, this is what we do. We divert the flow of blood from areas of excess supply to areas of deficit supply. So that is how we increase. We know that the kidney zone, to increase the circulation of the blood to the kidney zone, where we have to press, how we have to give the treatment, we know it. That is, Dr. Mehra has worked it out for us. So we just do that, and by that what we do, we are giving proper blood supply, and we are also nerve supplies also are restored, and by that we are removing this problem. Then digestive toxins, they accumulate. That is improper liver and bile flow. Okay. Then hormonal miscommunication via the medulla pituitary adrenal axis. Okay. These are all physiologically sound arguments. These are backed by physiology. Okay. So I am not telling anything which is non-scientific. And how we are giving the treatment, that also the results are based on this logic only we are giving the treatment. The dehydration at the cellular level, as I said, even if the person drinks water, cellular level dehydration is happening because of what we call as acidosis. Okay. Then acidosis also, there are 2 types of acidosis: metabolic acidosis and respiratory acidosis. So all these things you can know. So let us break it down with protocols. So elementary treatment protocols for kidney stones. Now here, 1 or 2 treatments may not be very easily done by oneself, but I will tell you the treatment, I will show you the treatment, and then you can, whenever you have the need, you can do this on your own. I will tell you one thing: kidney stones cannot be removed by only a few treatments, but we can give a lot of relief. Because if a person is having high BP, diabetes and obesity and kidney stones, which are normal corollary anyway, then unless and until I am able to get to the root cause and cure his diabetes or his high blood pressure, and then give him lifestyle changes to cure his obesity, I will not be able to get complete this thing, freedom from that propensity, pravritti in Hindi, the tendency to form stones. So we want to eradicate it, then you have to do all those things. So that is why it is not a one simple, very quick solution, but it is a solution is starts the road. Then depending on your individual cases, on your individual case history, then we will have to suggest other treatments. Okay. So now here is a very simple formula. We will come to this formula later. Let us first see what the formula does. What is the logic? So this is the formula. It's called 2-pan into 6, P heparin 6 ADR, then kidney clearance formula. Okay. Now what is its purpose? Purpose is it stimulates, there are 3-4 purposes with this thing. Stimulates lymphatic flow on both sides of the spine. This kidney clearance formula especially. Improves deep circulation and detox, this P heparin. Okay. Enhances filtration at the kidneys, that is done by this 2-pan into 6. What is the relevance in kidney stone? It helps to flush out the inflammatory debris and uric acid crystals. Just flushes this out. A big size stone, when we give 2-pan into 6, slowly, suppose you do it 4 to 6 times or 8 times a day, slowly the size of the stone starts becoming smaller and smaller. After about 15-20 days, you will see a big 9 mm stone has now become 4 mm stone, or maybe 6 mm stone. And after about 2 months of treatment, you see the stone is not there at all. Sometimes it can be faster also. Okay. So why that is happening? Because we are doing it at this level. We are this 2-pan into 6 It helps to flush out inflammatory debris and uric acid crystals. And by doing that, it indirectly improves hydration at a tissue level. And finally, it reduces systemic inflammation that can worsen hypertension, especially this formula called this place called 6-ADR. I have already shown this in a video in the group. It is there. I have shown it on my daughter how 6-ADR treatment is to be given. So this treatment is very simple. So like that. Then we are also having this adrenal gland, 6-ADR, adrenal gland activation. What is the logic? Its purpose is it stimulates the adrenal glands above the kidneys, and it balances what is a hormone called aldosterone, which is responsible for blood pressure also, and it regulates salt water balance. The aldosterone is very much responsible for salt water balance. Okay, then it supports blood pressure and energy metabolism. And its relevance in kidney stone is the adrenals control sodium retention. This is what physiology tells us. Then excess sodium can promote kidney calcium stone formation. Okay. Okay. Then it supports BP regulation in patients with kidney burden. Then we have treatment called for nephron activation via the flank or back area. That is a very simple treatment. It's called 5-organ clearance. And then we have a treatment called 2S4S5 for increasing the urine output. So its purpose is what? These are direct stimulations of the kidneys in LMNT. Number 1, it enhances nephron filtration efficiency. Number 2, it improves blood supply to the kidneys. Number 3, it supports urine formation and excretion. Number 4, it relieves local congestion, swelling, or inflammation. Now, it is not only one formula which does this, it is a mixture of several formulas by which we achieve all these results. Okay. Which formula is to be given when, for how many days, that depends on from person to person. Okay. Then so what are the uses of these formulas? Useful for kidney stones, especially greater than 10 mm. 10 mm means 1 centimeter. So bigger kidney stones. 2-pan helps the stone break up. Okay. Then in very early stage of chronic kidney disease also, these are very useful. Even in later stages, to a certain extent, it will help. Okay, it can reduce the frequency of dialysis, etc. Okay, but we prefer people to come to us in the earlier stages. Then hypertension due to kidney dysfunction, that is also reduced. It is useful for that. Then post-infection or post-stone passage recovery. Now, suppose you had a stone, and after the stone, that passage becomes, tender, painful. Okay, even though the stone has been removed by any method. Okay, either by surgery or by lithotripsy, whatever. Okay, then the neurotherapy treatments will help in post-infection or post-stone passage recovery. Then it reduces swelling or heaviness in the lower back and flanks. Okay. If there is mild proteinuria means protein going out in urine, okay, or low GFR and the kidney is sluggish, then also it is useful. This, especially this 2-pan intersects. And what is the relevance for kidney stone? The treatment is highly relevant in kidney stone patients because, number 1, it improves kidney function by dissolving and clearing small stones. It improves kidney function. Then it stimulates peristalsis in the renal pelvis. The renal pelvis is a part within the kidney. Okay, there I want the free flow of this thing, urine, and the filtration activity. So that is the peristaltic movement over there. And by that peristaltic stimulation, it aids in natural stone movement. The stone has to come out of the kidney and come into the bladder, then we can quickly remove it by any method. Okay, then it also supports electrolyte balance. This is important in calcium, uric acid, or oxalate management. Then it lowers local inflammation, especially when there is a back pain or hematuria or blood in the urine. Okay, then step 2. So these are all some of the various steps which we have done. Then we have liver detox and oxalate clearance. That those 3 formulas which I told do so many things. Okay, then liver detox, because liver is very important for helping the kidney to work properly. Liver and kidney together, they work in synergy in filtering the blood. Okay, so for that we have 1 point liver into 6 treatments. And what does it do? It boosts bile output to reduce oxalate, and then it enhances bile production and liver detox. Then it supports digestion and reduces internal toxicity. And in kidney stone relevance is it aids in reduction of oxalate overload by improving fat metabolism. You know, liver, whenever you give, it improves fat metabolism. Sometimes we may require gall liver, 1 point gall, 1 point liver into 6 treatments, or in many places 1 point liver alone is enough. So, and it improves fat metabolism. And when the liver and gut health are proper, then proper uric acid and oxalate metabolism takes place, and that is the key in stone formation. Then we also have a pancreas stimulation, that is 8 pan into 3 treatments. See, now you see how many treatments are needed for and why they are needed. It is not only one small treatment, though the major treatment is what I have already shown you 2 pan into 6, etc. But still, you require so much support. And that is why I want you to take this kidney class so seriously and do this. Whatever I am teaching you today, if anybody has kidney problems, even if you don't have, you can do it. That is the beauty. It is not, see, in a medicine, when you take a medicine, you can take the medicine only if you have that disease. Otherwise, it will cause more side effects. Whereas here in neurotherapy, especially these formulas, they don't have any side effects. They only have beneficiary effects. Okay, they are always being beneficial to everybody. So you can do that. Okay. Now, some of the people in diabetics challenge my earlier class, they would have known this formula, 10 medulla citric acid 3 gall. This is for what we call as cholecystokinin hormone, and that increases the pancreatic enzymes. Okay. So by all this, what we do, we stimulate pancreatic enzymes, and that is how it helps uric acid metabolism. Then we support insulin secretion and glucose metabolism. And the kidney stone relevance is high blood sugar is directly linked to uric acid stones. And enhancing the pancreas improves metabolism and lowers risk of metabolic syndromes. And additionally, also we will have a pancreas metabolic boost, that is 10 pan into 3 treatments, and that purpose is to strengthen the pancreatic function further, and it is used in chronic diabetes or stubborn sugar imbalance and it helps by correcting underlying glucose metabolism, which is essential in uric acid stone prevention, and it works synergistically with other treatments. Now we have seen this. For today's class, this much theory we have is good enough. Now we will come to the practicals. So we will see the main treatment for kidney stones. This treatment I am giving for diabetics. Suppose a person is not having diabetes, then we can add another treatment for people who are having severe kidney pain. That treatment I am not giving here now, because it will be 1 or 2 people only may have that sort of a pain who will be attending this class. But in case anybody has severe kidney pain, I mean the pain due to kidney stone, please let me know. I will put the formula in the group. Everybody can benefit by it, but more importantly, it should reach the correct person. So in case that person is not here, then you are not going to benefit. So right now, I am giving a formula which is useful for all people, whether they have stone or whether they don't have stone. And what does this formula do? Number 1, it removes small blockages. See, this is the formula 2 pan into 6. Now, people who have attended my earlier classes know this what it means. I will teach it for everybody, for the newcomers. Okay, this is 2 pan into 6. It breaks up. It has got multiple function. First of all, it rejuvenates the kidneys, and then second of all, it breaks up bigger stones, makes them into smaller stones. Then this treatment also helps in non-formation of new stones. So like that, this is one treatment which is very good for kidney, for circulation, etc., breaking up stones, etc. Then this P heparin 6-ADR, this increases P heparin, increases the flow of blood through all the parts nicely. So once the stones and blockages, P heparin, I mean 2 pan into 6, remove the blockages, then P heparin allows the blood to flow properly so that all the organs get proper blood supply. And 6-ADR treats any inflammation. Okay. Then kidney clearance formula, that is, this you can understand, it is for kidney to stimulate the blood circulation through the kidney for making better flow, which means any possibility, any small stones, they will just be flushed out. Like you have a drain, if there is some kachra in the drain, you just take one big bucket of water, and then all the small unwanted things are all just flushed away. Similarly, this kidney clearance formula will work. Okay. So now let us see how we can do this on our own. Okay. With this, we are now, I'm going to change the microphone.
1 second. I have a request from few to share the painful treatment of kidney stones also. And there are some few new people also here. So a sample of all the treatments that you have shown today, sir, so that they can go through and, write down or make notes and do it regularly. Thank you, sir.
Okay. No, that will come. That is coming in my next class. Today, because see, that is a treatment which is not given to diabetics. Now today I am teaching the treatment for kidney stones, especially people who are having diabetes and high blood pressure. Now for that treatment, which is very specific for a real person who is having pain, that treatment, it involves the thymus thymus gland, which sometimes increases diabetics. So that is why we will teach it, no doubt. I will teach it. I have no problem in teaching it. We will teach it. I will write it out separately and then teach it. Okay.
Sir,
Now we will let.
question. In case there is no high BP, pre-diabetes is there, but no high BP, then will the same treatment work, sir?
Hey, no, the treatment will work. Only that particular treatment, which is for reducing the pain, it is given only when the person actually has severe pain, because it stimulates the thymus gland. And the thymus gland we don't stimulate unnecessarily, because sometimes it can have autoimmune repercussions. The thymus gland is responsible for autoimmune disorders. So that is why we are going cautiously. First, I am teaching a treatment which everybody can do, whether they have stone or not, they will get benefit. And this treatment will benefit people who are having high blood pressure or not having high blood pressure, people who are having diabetes or not having diabetes, both. Just people who are on as I said, the kidney stone is the first formation. And many people develop first kidney stones, and later on it develops into full-blown diabetes or high blood pressure. So even for people who are basic problem, for them also this will be useful. So first I'll teach this, then I will teach that other one. That's only an addition. We can teach that. Definitely I can teach that. Okay. So now So, okay, now I will not be listening I will not be listening to you because I am wearing another Bluetooth headphone. I mean, ear this thing microphone. So I will not first listen to. I will not switch on my headphone. I
Okay,
will be
no
going
problem.
through the treatments. After the treatment, I will wait for questions. At that time, we can have the questions.
Sure, sir.
Okay. Okay. Fine. Fine. Okay. Well,
Ah, so, am I clearly audible?
Yes, sir. Very clear.
Okay.
Seen clearly and audible clearly.
Yeah, wonderful. So now the first point is called 2 pan into 6. Now this treatment in different places it does different jobs. So I have today we are using this treatment for kidney stones. It in other places I will use it for other things because it's a very wonderful treatment. Okay. So all of you, please understand whatever I am teaching today, in future also it will be useful for other disorders also. So 2 pan. Now pan we are giving over here. Okay. Now those of you who can sit like this, you can sit like this, you can have a pillow over here. Otherwise, you can also sit with your legs down. It does not matter because we are going to give treatment here. So you don't have to sit like this for 2 pan. For some other treatment, you may require this. But for 2 pan, you don't require to sit like this. So please be comfortable. You can sit with your legs down in a chair. I mean, in a chair or in a bed, whatever. But do not sit on a soft sofa and do this exercise. I mean, do this treatment. You require a place which is giving good solid support. So please do not sit on a low sofa and do this exercise. It won't help you. It may still produce some result, but that's not advisable. You should have something. So when you are sitting on a chair, then obviously the chair is supporting here. I need some support here. Okay, understand it. Here I need some support. And so I am now sitting like this. Okay, those of you who can sit like this can do so. Otherwise, please put one pillow over here. Okay, so once that is these things are all done, those of you who are going to practice with me, please have this. I am giving some time for you to get either a pillow or you wherever you are, how you are going to make yourself comfortable. Please do it because this treatment is only 6 minutes, about less than 6 minutes. Okay, so please do it with me. You will get benefit. Whether it is for kidney stone or not, it is good for the whole body. Okay, so now 2 pan. What is 2 pan? When I give I am using my palms like this, and I am using this portion of the palm and I am pressing into my groin, and approximately the location is approximately the middle point of this thigh, approximately middle point. I am pressing vertically down, and I am slightly pulling my fingers inwards. Okay, so I am pressing like this and slightly pulling inwards. Okay, and every time I am going to lean forward a little bit. Otherwise, you can't get proper pressure. You can't get pressure sitting like this. So you require to give pressure, so you have to lean forward. Okay, so now let us start the treatment. 2 pan into 6. I keep my hands like this, press over here, slightly lean forward, pull inwards. 1 1, 2 2, 3 3, 4 4, 5 5, 6 6. Lift and again keep in the same place. 1 1, 2 2, 3 3, 4 4, 5 5, 6 6. So this is 2 pan. 2 pan, this is now into 1. I have to give 6 treatments. So I have to approximately wait for about a minute. Okay. So in the meanwhile, I'll be telling you some things. You can all be listening to it. Okay. Now I'm going to do this scientifically. That means you wait for 50 seconds or 1 minute. Earlier, I used to just say, okay, let's go again to pan. But no, we'll wait, because you will then see the results. When I have now pressed this is doing some job in the body. So we should give it time to do that job completely. That is why that 1 minute. And normally in this 1 minute, I tell people do Nadi Shuddhi Pranayama, that is Anulom Vilom, alternative nostril breathing. Just you can do alternative nostril breathing if you like. So let us do for 1 or 2 rounds alternative nostril breathing. So all of you close your right nostril, inhale through the left. Close the left, exhale through the right. Immediately inhale through the right. Close the right, exhale through the left. Second round, inhale. Exhale through right. Inhale through right. Exhale through left. This is approximately 1 minute now. Okay, approximately 45 to 50 seconds. Okay, so this much time you must give. So now we had 2 pan into 1. Now again, same place, same location, 2 pan, second round. So keep your hands like this properly. Pull inwards, lean forward. 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. Lift and release again. 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. So this is the second round of 2 pan. Okay. Again, we'll wait for about a minute. So again, same couple of rounds of Nadi Shuddhi Pranayama. Now I am going to do it slightly slower. That means you can take nice deep inhalation and nice deep exhalation. Okay. Because the first time is new, many people will not be able to take so long inhalation, exhalation. But now you can. Okay. So now again, we are crossing the right nostril. Inhale through the left. Close the left, exhale through the right. Inhale through the right. Close the right, exhale through the left. Second round, inhale through the left. Close the left, exhale through the right. Inhale through the right. Exhale through the left. So this was, we have finished 2 rounds of 2 pan. Now we go to the third round. Again, we are placing our hands like this. We have to pull every time inwards. Now let us see. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Lift. And again, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. So this was 3 pan. We have to do another 3 more. So totally we have to do 6. 2 pan into 3 it was. Now we have finished 2 pan into 3. We will have to go to 2 pan into 6. So same way we start again with Adi Shuddhi. Inhale through the left. Close the left. Exhale through the right. Inhale through the right. Close the right. Exhale through the left. Second round. Inhale through the left. Exhale through the right. Inhale through the right. Close the right. Exhale through the left. One more round. Inhale through the left. Exhale through the right. Inhale through the right. Exhale through the left. So now we are going for the 4th round of 2 pan. That is 2 pan 4th round. So again, same way, keep your hands like that. Pull inwards. Lean forward. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Lift and again, do again. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Again, same cycle. You yourself will see by doing this alternative nostril breathing itself, you are going to get a lot of benefit. So we are combining everything. So because we have to give the gap, I have to give that gap. So in that gap, I am helping you to do alternative nostril breathing. So again, we are starting from the left. Inhale through the left. Exhale through the right. Inhale through the right. Exhale through the left. Inhale left. Exhale right. Inhale right. Exhale left. So now we are ready for the fifth round of 2-pan. So again, as usual, keep it here and make sure you are feeling a little bit of pressure over there. Okay, you have to press. Okay, now lean forward, pull inwards. 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. Lift. And again, same location. 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. Okay. So again, last round of Nadi Shuddhi for this sequence. Okay. Again, inhale through the left. Exhale through the right. Inhale right. Exhale left. Inhale left. Exhale right. Inhale right. Exhale left. So now we are ready for the last round. Pants palm here like this. Lean forward. 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. Again, 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. Okay. So this was 2-pan into 6. After this also we have to wait for 1 minute before proceeding to the next treatment. In between, we have to give time for this last pan to work now. So we have to wait for 1 minute. So I am now using that to chat. You can, those of you who want, you can also do Nadi Shuddhi Pranayama now. Okay. So we'll just do that. And in the meanwhile, 2-pan into 6, what did it do? It removes all blockages in these things. It removes all unwanted things which are debris, etc. Then it clears blocks. Suppose there are any small, no, like tumor, not exactly tumor, but anything like that, small clots, etc., blockages, all those things can go. Lipoma can go by this 2-pan into 6. Small flesh globules. No, some people develop lipoma all over the body or in many places. In about 1 week of doing this 2-pan into 6 treatment regularly, it will go away. Okay, and it won't come again normally. Provided, of course, you find out what is the root cause. That is, root cause will be in the liver. So that way you can understand. The lipoma is nothing but fat, globules of fat. They've been accumulating in various places because of poor circulation, and that's all connected with the liver. So this 2-pan into 6 can wonderfully remove those lipoma. Okay, so this way you've got the treatment now. This was the first treatment for kidney stones. We require more treatments, another 2 more. Second treatment is called P heparin and 6-ADR. Now 6-ADR has to be done behind. It is not easily done by oneself. Okay, so I have already put 6-ADR in this thing in the group. You can locate it. It has been put 2-3 times in the group. I have done it on my daughter. So 6-ADR, we won't be able to show because it requires you have to give a treatment between T6 vertebra to T12 vertebra. You have to give the treatment. I will show how the treatment is to be done over here, but that has to be done in the back. Okay, so that I will show because I want to show everything to everybody. But certain things cannot be done by oneself. You require a help. because it's not easy to do on your own back. It's very difficult. Okay. A person who can do namaste behind, namaste, there are some people who can do namaste behind. Those people can do 6 ADR on their own. But I don't think everybody will be so proficient. Okay. So now P heparin. Now P heparin consists of 3 points. First point is called 8 pan. Like 2 pan we did, we have to give 8 pan. Okay, 8 pan. Then second point is called 7 liver. 7 liver is given on the left hand and left thigh. Second point. Third point is called chest only. It has to be given over here. How it is to be given, we will show. Okay, so 8 pan, we start P heparin, 8 pan, 7 liver, 8 chest only. These 3 have to be taken together without 1 minute gap. No gap in between. That is the most important. 8 pan, 7 liver, 8 chest only. How it is to be done, we will show you. That whole thing together is called P heparin or plasmin heparin. Okay. So let us see how it is to be done. Very wonderful treatment for increasing circulation throughout the body. And now that 2 pan has paved the way by removing all small clots, this P heparin will work wonders. And that is how it helps in kidney stones. It allows the flushing out of whatever unwanted things is there in the kidney. Okay, so now 8 pan. Again, same way, 8 pan here, but instead of now 2 pan, I am going to do 8 pan. So 8 times I have to give in the same location without a stop. Okay, so fine. Let's start 8 pan. Now we keep it here like this. Again, I have to pull inwards. I have to lean forward. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Lift. Again, same location. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Lift. Same location. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Lift. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Lift. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Lift. 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Lift. 7, 1, 7, 2, 7, 3, 7, 4, 7, 5, 7, 6. Lift. 8, 1, 8, 2, 8, 3, 8, 4, 8, 5, 8, 6. 8 pan over. Liver. See, I have to give in 3 locations. 1, 2, 3. I have to press here, and simultaneously the back of my hand, this bone over here, that will be pressing on my groin, on my thigh. 1, 2, 3. 3 locations. And like that, we have to do 7 locations. So how we will do it, we'll see. Okay, first location, I place here like this, I press here, I pull inwards, then 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. This is my left hand. Please remember, this is my left hand and left thigh. Second location, see, first location here, second location here, and here again, earlier I was here, and now I am here. Again, I pull inwards, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Third location here, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Then without stopping, fourth location, first location, fourth location, same. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. I'm changing location. Here also changing. 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Then last, center again. 7, 1, 7, 2, 7, 3, 7, 4, 7, 5, 7, 6. So 1, 2, 3, 4, 5, 6, 7 in the middle. So this was 7 liver. Now chest only, we have to start from the left side. Okay. And I am going slightly diagonally. I have to press like this. I am going upwards. Okay. 12 times I will do here. 12, 12, 12, 12. Okay. Like this. It's simple. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12. This side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Again, here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. This side 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12. That's all. 8 pan, 7 liver, then 12, 12, 12, 12. That is called 8 chest only. Now, this nomenclature, you have to just take it. 8 chest only means total I have to give 12 into 4, 48, out of which 12, 12, 12, 12, like that we are splitting. Okay. So that is 8 chest only, it is called. Okay. So this, all these three together, 8 pan, 7 liver, 8 chest only, this is called P heparin. And this is wonderful for improving the circulation in the body as a whole. And that it is good for reducing diastolic blood pressure. Okay, by at least a few points, diastolic blood pressure comes down, especially when done for a few days, then it comes down better. Okay, now, 6 ADR. Now, I have seen you will be seeing the video in the group, it is there already. But right now, I will show you, it has to be done where between the vertebra T6 to T12. So how do I do it? How is the treatment to be done? Very simple. So I have to keep my hands like this over there. Okay. Somebody has to do it for you. Okay. You are keeping your hands like this, such that this finger is approximately, this area will be approximately in the region of T6. How do you locate T6? Just lift your hand where the scapula ends. Where the scapula ends, the shoulder blade, where it ends, that place where it ends, that is approximately T6. So I keep my base of my palm approximately just below that T6, just below that shoulder blade. You don't have to keep it on the bone, just below the bone where there is no bone over there. After the shoulder blade is over, then you have got a slight depression. You keep your hand over there. And how you have to give treatment? You have to this index finger, you have to press it on the back like this, and that will become a fulcrum. So then, keeping that as a fulcrum, I have to move like this. So I will show you here. You can see here, it's very simple. You just see, all of you, how it is to be done. It has been done very nicely on my daughter. So, but here, because it's part of the treatment, I'm just showing you here. Now here, you keep your finger like that, and then slowly 1, same place 2, like that we have to do 6, 3, 4, 5, 6. So this was in the region of approximately T7. Okay. Then slightly come down a little bit. Again, same way. Slightly come down a little bit on your back. Then again, see, you must make sure that this V is not spoiled. See, you have a V over here. You see, I have a V. So that V should remain like that. You should not give like this. You should keep that V. And then keep this. Again, second round, 1, 2, 3, 4, 5, 6. So 6. Again, here, a little bit below. 1, 2, 3, 4, 5, 6. So approximately T7, T9, T11, approximately over there, T11 or T12. So these are the 3 locations. Again, we have to repeat it. Again, we have to go forward to T7, 1, 2, 3, 4, 5, 6. Next, below 1, 2, 3, 4, 5, 6. Below 1, 2, 3, 4, 5, 6. So this whole thing is called 6 ADR. It stimulates cortisol. It reduces inflammation in the body. Last time I told you that if anybody is having a mosquito bite, small children, they get bitten by mosquitoes. For them, the 6 ADR is a wonderful treatment. Like that, it works. Like that. The reddishness of the mosquito bite will go away. The itching, burning sensation will go away. That's the beauty of it. And it works in many places. Nowadays, you don't have scorpions in the houses, because now everybody is having RCC construction. But in village houses, scorpions are a problem. And anybody who gets bitten by scorpion bite, if the 6 area treatment is repeated several times, give every 20 minutes or every 15 minutes, within 5 to 6 treatments, the pain of the scorpion goes away, the swelling goes away, and within 2 days, the person is absolutely hale and healthy. We have seen such cases in our academy. So I'm telling you, it's all backed with this thing. And what we are doing, we are stimulating cortisol, which is known in physiology as an anti-inflammatory steroid made by the body. And because it is made by the body, it does not have any side effect. Understand? So that's the beauty of this treatment. P heparin followed by 6-ADR. Okay. So this is the treatment. These two treatments itself work wonders. Now we are coming to the real kidney clear treatment. Now kidney clear treatment. This is called 3-wala. We have got kidney clear in various stages, but 3-wala is adequate. So how do you give this treatment? Here we are stimulating the kidneys in 2 ways. Okay. One is I have to stimulate the left kidney. We call left kidney as mucus 0. I have to stimulate the right kidney also. So first we stimulate the right kidney, that is called liver 0. Then that's the code name. The treatment's code name is liver 0. And secondly, we treat the left kidney, that is called mucus 0. Okay. So how do you do this? Now the kidneys are situated over here. Now Dr. Mehra, by his uncanny intuition and backed by later by observation and inference, he found out that suppose a person, he gives pressure simultaneously over here and over here, and like that goes down. The position on the hand does not change. The position on the leg changes. Okay, this left side, the right side, this is my right side. When I do it over here and here in 3 locations, it stimulates the left kidney. And when I do the same thing on the left side, I press over here and I press over here, here and here in 3 locations. How it is done, I will show you. It stimulates the left kidney, the right kidney. So first we have to give the right kidney treatment. It is called liver 0. When I use the word kidney, don't get offended. It is not for any problem. It doesn't indicate any problem. Now we are giving it for kidney stone, so I am using that word. Otherwise, we use the code word liver 0, mucus 0. That's all. Liver 0, mucus 0 is the code word which we use, and it's a very simple treatment. Very, very easily anybody can. But what it is doing, when I am pressing here and here, it is forcing the blood on the right side. I am pressing over here on the left. So when I am pressing over here, the blood is forced to the right side. Where it is forced is approximately the region of the right kidney. Okay, where the right kidney nerves circulation flows, it is stimulating that area. That is why this called, I am telling that this is stimulating the right kidney. Okay, so it is called liver 0. Fine. So how do you get this liver 0 point? As I said, first I have to keep where is the point, the location of the point on the hand. This is the shoulder joint. This is the shoulder joint. Just outside of the joint, if you touch here like this, you will find one place. You can either touch like this. Okay. Now you can see immediately after the shoulder joint. This is the shoulder joint. Immediately after the joint, if you touch, there is one place which slight depression type. No, that is the place that is the muscle, the muscle over there. Okay, and that is causing a depression. That is the place which we have to press. Okay. Normally, when we are giving treatment with the patient lying on the floor, if the moment we place our hands here, automatically that place will get pressed. Now here we have to give treatment on oneself. So what we have to do, we have to use our thumb, and then we can locate that point and then press over here. So now once the point is located, then I can put my hand down. So first I locate the point. This is on the left side. I am locating the point. Okay. Then here, what I am doing is, again, here I have to come to 3 locations. 1, 2, 3. So keeping this hand over here, I start. This is the liver 0. The liver 0 first point. I start, press together 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Then here go down. This same place pressure here, pressing here is the same point, but here we are down, coming down. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Then third point, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. So this was 3 liver 0. Now here 3 mucus 0. Same way, locate the point over here, just outside the shoulder blade. Just locate the point, press with your thumb over there. Then with the other hand you press here. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Second location, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Always pull inwards. Third location, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Okay. So now this was liver 0, mucus 0. Then you have got chest only. The treatment says 4 chest only. 4 chest only means 12, 12. When I say 8 chest only, 12, 12, 12, 12. So now 4 chest only. So lift your hand slightly higher. Then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. This side, 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12. Now, the fourth point is called 10 round arrow. Now, round arrow means my vertebra, it is my, let us say this is my vertebra. Okay. Now, I have to start from the top, that is, say T7, T1. T1, from T1, I have to go all the way down and I have to make a U-turn and then again I have to come here. This I have to do there. But now when we are doing ourselves, we don't need now another person. What we will do, the vertebra is also reflected over here. All of you know that our entire spinal cord is reflected over here. Understand? So all that I have to do, the same thinking, that is the location, I am going to give treatment over here, and that way my treatment will be completed. And I have to give 10 rounds. So what I do, I keep my hand like this. I start from exactly from the tip of the big toe. I go from there. I go actually in the back. When I do, I will be doing approximately from this location. That is C8 or T1. Okay, but here we can do from here. We can go from here straight. We go down like this. Now we go down and then slowly we come up. This is 1 round. Like that we have to do 10 rounds. So like this, I go down and again come up. Second round. Now third round. Then slowly count each vertebra and then do it. Fourth round, fifth round, then sixth round, seventh round, eighth round, ninth round, 10th round. So with this, we have completed the treatments for kidneys, stones. But this treatment, I have given it using this as a remote control. I have given it over here on the edge of this thing, which is representing the vertebra. All of you know this vertebra is represented over here. But in a patient, or if you have a helper, please lie on this thing with about 1.5 pillows, 1 pillow and another pillow, half of it. So you lie like that and then ask your helper to give like that. The treatment will go like that. Okay, so you have to keep your hand like this and then start from here, approximately T1. From T1, you go right up to L5, then come up. This is 1 round, then 2 rounds like that, 10 rounds can be done. So this is a wonderful treatment. So the first one was 2 pan into 6. Second one was P heparin 6 ADR. The third one was this kidney clear treatment. Now with all this, we have really, this is enough for normal kidney stones which are not giving pain. Now suddenly, Anusha madam requested, no, please teach for person who is having pain. Suddenly you get the pain at night. Then we have to give treatment in the, we have to give treatment over here in the sternum region. Here behind this bone is the thymus gland. So we have to give treatment for that. We will give the entire treatment, but instead of this chest only round arrow, we are giving liver 0, mucus 0, same way, liver 0, mucus 0. Then after that, for people who are having pain, we give what is known as 8 thymus chest. So how do we do 8 thymus chest? Very simple. Same we have to do over here in this region. Okay. So now here we give first in the left side, then in the right side. And left side we have to give in 3 locations. First, one point over one treatment over here, then another treatment over here, then another treatment in the armpits. Okay. So now let us see how this treatment is to be given. So I keep my hand slightly at an angle. I have to do 12. I have to do 12. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Here in the chest. Then here, chest earlier, like how we did chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So here 12, here 12. And here we require only 8. This is for stimulating the lymph nodes. 1, 2, 3, 4, 5, 6, 7, 8. So this is 12, 12, 8. Now on this side, same 12, 12, 8. Again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then armpit, 1, 2, 3, 4, 5, 6, 7, 8. So 12, 12, 8. Normally, this itself is enough, but for severe pain, we will repeat it once again. This is called 8 thymus chest. The first one was called 4 thymus chest. If I ended now, it will be called 4 thymus chest. Now this is once again I am doing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Very light stroking. Then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And here a little bit pressure. 1, 2, 3, 4, 5, 6, 7, 8. Then this side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then here, 1, 2, 4, 5, 6, 8, 9, 10, 11, 12. And here, 1, 2, 3, 4, 5, 6, 7, 8. So this is a wonderful treatment. This is a wonderful treatment for kidney stones. And this 8 thymus chest, it is used in other places also. In other formulas also, it will be used. for wherever there is pain, we use this. Okay, but it has to be mixed with other points. Okay. Those are all as the requirement comes, we will teach. We will deal that. And incidentally, my English classes for my regular students is just started a few weeks ago. And then anybody who already 2 people have shown interest. So if I will talk to Joshi sir, and then we can have a session for that also. It will be a 6-month course. So I will be talking about it later after this diabetes challenge class. We'll talk about it. Okay, now diabetes challenge. Those of you who have not who have diabetes and who have not joined this thing, please join this thing next month on 11th of July. We'll be starting with the first class. And before that, please all of you book your this thing seats, and then we'll have the class. So with this, I think our time is also over, and I have done a satisfactory job. We have more of theory. We'll cover it in the next class. We'll continue this with other things about the kidney stones. Okay. So if anybody has any questions, now you can all ask. You can raise your hands and ask. And
I can request and take up only 2 questionnaires for this session because already time is up. So only 2 questions, please, and only 1 question per each person, not more. And we'll be ending this session by 10 p.m. So with that, we'll be ending. And any more queries, you have to go back to the group and say at neurotherapy and write your question, feedback, and everything. So please remember that. And for now, we are taking only 1 question per 1 person and only 2 questions till 10 p.m.
yes, sister. Tell me, sister.
Namaste, sir.
Namaste.
Sir, twice I had kidney stone, sir.
1 minute. Let me just. Yes, please go ahead.
Twice I had kidney stone, sir. May I continue this exercise, sir? Treatment?
Wonderful.
Twice I had, but I did not take any allopathy medicines. I don't know whether there is infection or not, but I'm not having any pain or any blood urea and any urgency urine, nothing. But it is normal. But whether I'll continue the same treatments, no, sir, to further
Certainly.
not to again to form the kidney stones. Because
Exactly.
twice, within 3 years, I had twice kidney stone. First time I had 5 mm. Second time I had 12 mm. First time I had treated with Ayurvedic medicine. Second time I was at severe pain, so I underwent surgery.
Have any question?
Yeah, you can continue.
Uh,
Thank you.
I can continue everything, Nama.
Sure. Yeah.
Okay. Thank
Especially, you continue liver a little bit more.
Okay, sir.
Okay, 1 point liver, you can give a little bit more.
Okay, sir. I
Along
can
with
continue this 2 pan, 2 heparin, and 8 chester.
No, you have not written it down properly. I will send the screenshot in the group. You can
Okay,
see
sir.
it.
Okay, sir.
Okay. Thank
Okay,
you.
sir.
Now,
Thank you, sir.
Srinivas Moreji. Yes. Srinivas More. Yes.
Sir, namaste.
Namaste.
Sir, I have kidney stone in 2017, sir. It has been treated by laser therapy. Now I am suffering low urination, and while that time doing that procedure, urethral stricture is happened, sir. Stricture. I consulted the doctor. He told that some of little bit of the tongue skin has to put on the whereas the stricture is happened. I am not I not got ready, sir, to do that one. So any treatment in this neuro system, sir?
Yeah.
Can I repeat this whatever you have told now, sir?
So I will now answer you, but I won't listen to you.
Sometimes
So
sometimes
this is a wonderful
I
question.
suffer with
The person is having stricture because of when after as we age, the skin thickens and then it becomes it literally it starts shrinking the diameter. So for that we have got a wonderful treatment. Unfortunately, it has to be done before this. Whatever you are now, I have now taught you 2 pan into 6 and all. Please go ahead and do it. That is perfectly okay. And along with that, we will require one extra treatment, and that is called 15 left medulla, 6 left sweat, 8 left tarku. Now, this treatment is wonderful for opening strictures. But I don't want you to go to that immediately, because you see, right now you are having that probably there is some stone which is or some blockage which is there. Okay, that is a bit drastic treatment. If you first do this for about 15 to 20 days, you do whatever I have said, do this at least 3 times a day, this sequence. Okay, you do it 3 times a day. And then after about 15 days, then we will add one treatment if necessary, if you find, because you see, this treatment itself is very powerful. So we will use it. It's a simple treatment, and you have seen that this thing, that is a bit complicated treatment. It has to be given by somebody else. You cannot do it on your own. It will be very difficult to do it on your own. So that one we will give it after about 15-20 days. If necessary, we will add it. But right now you do this. Whatever I have taught you is very good for that problem. And the stricture also, it will start slowly getting opened up. You may not require to go for the surgery right now. Let us see. I think this should help you. Okay. Okay, who else? Okay, nobody else. Very good.
Request you all to please go back to the group if you have any queries. And now we'll be finishing this session. So please wait for the blessings and go back to the group and give your feedbacks. Thank you.
Yes. Okay. My sincere and heartfelt thanks to Joshi sir, Joshi's Kerala group, and Insha madam for having given me the inspiration to take this class. And we again pray to our Guruji, and we have a very standard prayer for him. Yug Purush, Dhanvantri Swarup, Neurotherapy Ke Janak, Param Pujya Guruji, Dr. Lajpat Rai Mehraji ki jai, because he has found this wonderful treatment philosophy and methodology. So we do that. And now I take this opportunity. May heaven's choicest blessings be on all of us, on all of you and your families and the families of your friends and relatives and everybody in the world. May they all be blessed with health, happiness, harmony, peace, prosperity, and success. May all of us be blessed with health, happiness, harmony, peace, prosperity, and success. Thank you very much. Good night.
Thank you so much, sir, for your blessings, for this wonderful session for everyone, and explaining patiently on the treatment also, so that they can just start it from today. And if you have noted down, you would be able to start it from today. If you would have observed carefully, you can easily start it from today. And the recordings will be shared soon to you. So no worries. You can go to the playlist and go back to other sessions also. So please keep an eye on these classes, because these are provided free of charge to all of you for your benefit only. So please utilize it, share it, and just get the benefits out of all the sessions. Thank you so much. Sending all your gratitude to Ramachandran sir from all of us. Thank you for this wonderful session for Joshi's Kerala group, sir. Gratitude, gratitude, and gratitude to you. Thank you so much, sir. God bless you always. So with this, we end this session. Happy weekend to all of you. Tomorrow we have 8 p.m. We have a numerology trial class. So I request everyone to attend that. And please provide your feedbacks, queries, anything with at neurotherapy. Specify at neurotherapy so that Ramachandran sir can know it belongs to his query. Because there are so many trainers in the group, anyone won't know whom you are asking. If you say sir also, they won't know. So you please write at or ash neurotherapy so that sir can understand you are asking query about neurotherapy and he can answer you whenever he gets time. Got it? So thank you so much for attending this session. A happy weekend to all of you. And with all your gratitude, I am sending further to Ramachandran sir from all of us. Thank you, sir.
Okay.
Good night, sir. Happy weekend, sir. Bye, sir. See you
Bye.
next Friday. Thank you,
Yes.
everyone. And tomorrow, please attend the session. Thank you, everyone. Good night. Bye.